as Dr. Shane explained, I'll walk through a little bit of the content of the standard as well as the experience of the Commission implementing the standard. So slide 20 just walks through a little bit of the mandate of the Mental Health Commission of Canada. We are funded for 10 years and we're currently 5 years into our mandate. We really have 3 strategic roles, which is to be a catalyst, to bring people together and collaborate, and to ensure sustainability of the work. Next slide. In May last year, the Mental Health Commission of Canada released the Mental Health Strategy for Canada. It calls for the creation of mentally healthy workplaces, and one of the specific recommendations actually was to create and implement a national standard on psychological health and safety. Luckily, we already knew that it was being created, so that was easy to put as a recommendation. The next slide is one of them that I find very interesting, and it just reiterates the importance of mental health at work. In lots of charts where you're looking at prevalence and incidence of many different illnesses, often you will see an increase in prevalence as well as incidence as age increases. But as you'll notice in this chart, there's actually a peak right at between 13 and 50, but mostly we say 20 to 45, which is really the time that we spend at work. It's really those early working years that are most affected. So I find that a very powerful slide. Slides 23 and 24 repeat a little bit of what Dr. Shane has already covered. But essentially, it's just reiterating that we spend most of our waking hours in the workplace. So more than 60% of our waking hours are actually spent at work. And it plays an essential part in maintaining positive mental health. And any health or harm created in the workplace can actually migrate into families, communities, and society as a whole. The economic case for action, which is what most organizations and businesses, corporations find very interesting, which is on slide 24, is the costs, which Dr. Shane also touched upon, which is that nearly 30% of disability claims and 70% of the total costs are attributed to mental health and mental illness. And we recently did a study, which is indicated in the last bullet, where we looked at the economic impact over 30 years, and it actually showed that if we do not do something now and intervene and make a difference, we will be spending more than $198 billion over the next 30 years on mental health due to lost productivity. So slides 25 and 26, I won't go into too much detail because I think a lot of this was, touched upon, but this actually comes from work that Dr. Shane had done, which really laid out the legal, scientific, and social foundations for this new standard. And slide 25 really shows that there are many risks to mental health, and they're more likely to arise and contribute to a psychologically unsafe workplace when we consider several factors. And those include the ones listed here, which is, job demands and the control and reward. And slide 26 just depicts that concept into a diagram, which you can see in the center that if employees are putting in a high level of effort but are receiving a low level of reward, plus there are high demands and there's little control, you can see that that this results in strain both mentally and physically. So I'll move on to the next slide where we really talk about why a standard. And I think it's probably become evident quite quickly that it's cost effective. It improves risk management, which every organization is looking at. It can increase and help with recruitment as well as retention. And as we always add in, it really is a corporate and social responsibility. So slide 28 just walks through a little bit of the background, which started with an economic and global business roundtable, and Dr. Shane's work, which I really feel is a foundation to why we are where we are today. We held a consensus conference along with Great West Life, and we brought together various stakeholders, business, labor, clinicians, and there was a unanimous consensus that Canada needed a national standard. We didn't need guidelines, we didn't need a framework, we needed a national standard. So in 2010-2011, we started working on a standard, and it was released January 16th of this year, so only about 2 months ago. So slide 29 is just a picture of the cover of the standard, which I'm sure many of you have seen today. Goal of the standard, which is slide 30, really focuses on mental illness prevention and mental health promotion in the workplace. And as Dr. Shane had mentioned, it's intended to help prevent harm to all people in the workplace, whether you have or don't have a mental illness. And that's a really important point. And it was something that was, I guess, misunderstood throughout the development process, that, okay, now this is something to help people with mental illness. This is really to create healthy workplaces, to help those who do have mental illnesses, but really it is to prevent and to promote mental health. So on the next slide, 31, it just describes some of the important pieces of the standard, that it really is a guide that offers organizations a structure and process for changing how mental health and mental illness is approached in the workplace. Important point is it's voluntary. I know you probably all know about other standards that are legislated. This is voluntary. It is aligned with existing standards, many of them that you know, and it is applicable to any organization. The standard went out for consultation for 3 months, and one of the things that did come back was, most organizations in Canada are small and medium. Some are government, some are corporations. They're all built very differently, and they felt that the first iteration of the standard really didn't meet the needs of all organizations. So I know the technical committee, who really developed the content of the standard, spent countless hours reviewing and assuring that this is something that could be applicable to all organizations, whether you're small or medium, private, public, and something that would be accessible to all organizations. And what I mean by that is, for many standards that exist, you have to spend money to access it. This standard is completely free. And that was very rare, from what I understand from the standard organizations, for a standard to be at no cost. So what we as a commission had to do is we had to actually go out and get funding. So on the next slide, it shows that it was really the Canadian Standard Association and B&Q, the French counterpart, who were the standard organizations who led its development. But we had to get funding from public and private partners so that they could do their work. Because in the end, we wanted to make sure that it was accessible, and that was the only way that we could do it. On the next slide, it just talks about the technical committee, which I just referred to, which was a group of volunteers who represented various sectors who really developed the content of the standard. Now, usually technical committees, from my knowledge, can be between 10 or 15, but this technical committee, just because of the uniqueness of the standard, had more than 30 people. And so some of that is why it led to, taking longer than we had anticipated. And also when we had taken it out for the consultation, I remember saying to my boss, I really hope that we get 40 or 50 people to actually submit comments, because it's quite a rigorous process. You have to fill out a form, and I thought, if we get 50, 60, valuable comments on the standard, this will show that, this is something people want. We had 866 comments. So that just shows about the need and the interest that was there, and also, again, attributes to why this did take a little longer than we had hoped for. So slide 34 just walks through the overall process, which I'd like to highlight was the standard process that any other standard has to follow in Canada. The National Standard Council actually reviews the process, and with their stamp, that's what actually makes it a national standard. And in late November, we received that approval. So the only thing I'd like to highlight was that this followed the rigorous standard process, which is a consensus-based process, which is defined as a substantial agreement, which implies much more than a simple majority, but not necessarily unanimity. So right now, we're in the dissemination phase, and it will be reviewed up to 3 to 5 years, and will only be free for until it's revised. So we say it's free up to 5 years, but it may lose its kind of free access before that time period. Slide 35, you'll just see pictures of various organizations, and this was just to emphasize the point that the standard is applicable to any type of organization, no matter its size. It's really intended to provide guidance for changing how businesses and organizations approach mental health and mental illness in the workplace. So some will want to focus on policies and processes to start. Some will start with a gap analysis. and others will start maybe with management training. So every organization, though it's applicable, people will approach it in a different way. So slide 36 goes into the content, kind of the meat of the standard. And I'm sure many of you have seen the standard, but if you haven't, the standard is actually only about 15 pages, and the meat, I would say, is about 10 pages. The rest is annexes. I find them extremely important and unique to the standard, but really the standard and the content, especially clause 4 and 5, are really only about 12 to 14 pages. And slide 37 talks a little bit about those annexes that I just referred to, which to me is a huge chunk of the standard. It includes background information, it includes resources, case studies. It actually includes models or sample case studies for small and medium organizations. It includes discussion of relevant legislation and other information on related standards and other tools. So slide 38, I'm just going to walk through a little bit of the contents, which I think is, the important thing that many of you are on. Actually, I'll go to slide 39 and skip 38, just to emphasize that the standard addresses 13 psychosocial factors. And this is involved, you can see it in the standard, it's in the appendix, it's throughout. But I won't walk through it today because we don't have that much time. I'll go right into the content, which starts on slide 39. So when I had the slide up about the contents of the standard, you would have seen that one part of Section 4 is commitment, leadership, and participation. And that's really the foundation of the psychological health and safety system. It is extremely important for an organization's leadership to be engaged in the standard from the beginning. They have to believe in it to gain participation from the employees. They're really the people that can set this into motion. And employees or workers really need to have the opportunity to participate. They need to be consulted, and they need to be involved in the development, implementation, and the continual improvement of this system. They need to be included in the policy and process development, and we have to ensure throughout this process that there's confidentiality and privacy rights. And honestly, this is not just a right, it's essential in building trust within this system. The next slide looks into planning, which I think is one of the most important parts. Planning really helps an organization to identify and prioritize any psychological hazard or risk in the workplace, as well as any legal requirement that may exist. So this is done through collecting data, through employee surveys, and just making sure that you monitor and your progress and measuring success. By diversity, what we really mean is that it's important to take into account the diverse needs of your organization's employees. So not all workers have the same needs, and you need to tailor towards their diverse needs. So once you collect your data and you look at your information, it's really important to set objectives and targets. And I can't emphasize that enough. Because how do you know where you're going if you don't set targets and objectives? And you really need a system to manage change. The standard highlights that an important aspect of managing change is ensuring that there is excellent communication with staff, information sessions, and training where necessary. And so you really need to ensure throughout all these points that employees are engaged. So I'm on slide 41 now, which is the first slide on implementation. So you'll see that the first point is around infrastructure and resources. And that really means that it's key that the people who are involved in implementing the standard have the knowledge, the skills, and the abilities to carry out their roles. But in addition to that, they have the resources that they need to implement the standard. So, for example, in our organization, when we said to our HR department, you're going to lead this, we also had to give them the support, we had to clarify roles, and we had to put some resources behind it, because it does take some time and resources. When I speak about preventative and protective measures, it means that you need to put measures into place to address the risks and hazards that were identified by the organizations. That may mean privacy barriers or support animals for social anxiety. In regards to education, awareness, and communication, really what I'm talking to around that is when you develop new policies or you amend existing policies, you need to raise awareness, you need to train, and you need to communicate this to all staff. The organization should put into place processes that will ensure a sustained implementation, including making sure that senior leaders and leaders at every level sponsor the process. So that means in our organization, we had our board of directors approve a policy statement, and at every HR committee of our board, we actually present on where we're at with this system and our continual improvement, our measurement, and our progress to date. The next slide is a continuation of the implementation. And you really need to make sure that you have a governance plan in place. And what I mean by that is outlining very clear responsibilities and accountabilities for those involved in the implementation plan, and ensuring a sound communication plan so that staff are constantly aware of it. The standard states that there be a process for assessing and addressing the competence in the area of people in leadership positions. So within our organization, we just recently, I think only a few weeks ago, released a competency framework for all staff, and that included training. The next clause talks about critical event preparedness, and what I mean for that is for an individual, it is an event or series of events that has a stressful impact sufficient to overwhelm that person's usually effective coping skills. For an organization, it is an event or series of events that interrupt the normal flow of activities of the organization in a way that impacts psychological health and safety. So this clause, the importance of it is really to help employees who may be dealing with incidents within the organization, such as bullying, or something in their own personal life. So it's just about providing support for those employees while respecting privacy and confidentiality. And in regards to reporting and investigations, organizations could put into place procedures for reporting and investigating psychological injuries, illness, acute events, and even things such as suicides or attempted suicides. So the next slide, which is evaluation and corrective action, it is very important for a business or any organization to be able to measure its effort. And I alluded to this earlier when you're setting targets and objectives. Well, as important as setting those objectives are these policy objectives being met? How well are we actually promoting psychological health and safety in the workplace? So evaluation is a very important piece, and collecting data is important. So in our organization, we actually survey staff every year. We collect data from our benefits and other areas, and we actually do focus groups once in a while to collect that information and to get a good idea of employees' perceptions of how we're improving. So internal audits, which I've alluded to, are very useful, and they give information on how we're implementing and maintaining a psychological health and safety system. And preventative and corrective action means that organizations take the information they're actually learning through this process from the internal audit and make changes to improve their system. And slide 44, which is the last kind of piece of the content of the standard, is just having scheduled management reviews. So meeting with leadership or your board or the team and actually talking about where we're at, where are the gaps, what improvement and corrective actions are needed, and reviewing and updating, organizational policies, procedures, maybe even updating your objectives or your targets. It's just an important thing because one of the things the standard really emphasizes the piece of continual improvement. The next two slides, which I won't go into detail on, is the annexes, which really provide background information, tools, and resources. And for any of you who have the standards in front of you now, it starts on page 16. So I will kind of skip slides of the annexes and go to slide 47, which talks about how is the standard used. So again, as I've said before, it's really a guide, and there's no one size that fits all. It will be used differently by each organization, which obviously causes challenges because it's really nice to just say I have a silver bullet and this is what you do, but it's different. And it may be, the champion within the organization may be an HR department, as in ours, but in other organizations you may not have an HR department, or you may be such a large organization that you have a complete different infrastructure. And so it really is different. But the principles that kind of flow through that no matter where it is or what you're doing, you need commitment by senior management. And that often takes time, and even within our own organization as the Mental Health Commission of Canada, it takes time. Leadership turns over, board members turn over, so it's this constant gaining of commitment and buy-in from your senior management and your organization as a whole. Really that importance of participation with all, it takes more time and it takes more resources to ensure that everybody's included at the right time, but it's integral into really having an impact. Shared responsibility. It's not just an employer responsibility, it's an employee and an employer. And it really should integrate within your occupational health and safety system, your policies, your procedures. A great example of this is by legislation, we have to have an occupational health and safety committee. So about a year and a half ago, we created a psychological health and safety committee. And recently, within the last 6 months, we just brought them together. I mean, why have two committees and double the time? Let's just bring them together and address issues as one. And then just a focus on the health aspect, awareness and promotion, more than just safety, which I know often occurs. Slide 48 just has the websites on how to access the standard if you haven't accessed the standard yet. You need to put in your name, I think, and a few details, and you're able to download it. The reason we can't just send it to you is because it will be revised and there may be changes, and this is a way for them to help track who has the standard, and if there are changes, how to communicate with you. So slide 49 is one of the important slides for me. It's where we all say, what can you do now? I know everyone on the phone is from different organizations, different places in Canada, and have very different roles and influence within their organization. But there are a few things that I think no matter what your position is and role, you can do right away. One is read the standard, at least the 14 pages. You don't have to read the whole thing. I know it seems quite long. And take a look through the annexes. I mean, they provide really great information on how you can implement the standard and some of the background information that's so vital to getting leadership on board. Another thing you can do is engage your senior management. Maybe that's through a supervisor, but trying to get key leaders in your organizations to understand this, to buy into it, and understand the importance of it and the impact it can have. I've found with many of the organizations that you really need a champion, and it doesn't matter if that's at the staff level, management, executive, or even the board. Having one champion who can raise this and bring it up is completely vital, and so you can be that champion in your organization. You can use available tools to assess your current situation. There is a survey in it, in the standard called Guiding Minds at Work, which really assesses the psychosocial factors in your organization. What are some of the weaknesses and strengths? What are the perceptions by employees? We did that, and I can tell you it was a great experience. But, you know, as a leadership team, you are surprised by some of it that comes out, but it was so helpful to shaping how we would move forward. Develop a policy statement. So this is one of the first things I think I said that we did was we had our executive team approve a policy statement for the organization about our commitment to psychological health and safety. We had staff help develop it, and then it went to our board for approval, and it's somewhere on our website. I couldn't tell you where, but it's something that we're very public about, and it took a lot to get the leadership on board and to finalize it, but it makes a very strong statement, and it's a very good first step, I think, to take to demonstrate the commitment. And you can take advantages of other tools, such as mental health first aid, which on the next slide I'll talk very briefly about. But mental health first aid was developed in Australia, and really it's to help provide it's the help provided to a person developing a mental health problem. So it's trying to help. It provides the education and the information to people to help recognize the signs and symptoms of mental health problems, what to do for help. It's very similar to what most people know as first aid, but this is for mental health first aid. So this is on slide 50. And Mental Health First Aid joined the Commission in 2010. We now have 750 instructors, because you can either do train the trainers, which means you can become an instructor to train others, or you can just become what we call a first aider, someone who's taken the 2-day course. You have more knowledge about mental health, how you can recognize if somebody has a sign and symptom, what to say. And we have more than, this is actually incorrect, it's 72,000 people in Canada who are now trained. I've taken the course, and what I can say from a workplace standpoint is I've been in a situation where someone at work had an issue. I knew they did. I could tell, but I didn't even approach them or say anything. They ended up leaving on long-term disability. And I just now think if I had only taken this course, maybe I would have been able to approach them and talk to them, know what to say, know where to refer them to, and this is the kind of foundation learnings that this kind of course provides. And so on the next slide, 51, it just shows about how we've targeted towards the workplace. So we're actually going into workplaces and doing courses for management, for staff, whether it's 2 days, half a day, and tailoring it. And we're already seeing that it's having a significant impact. There's really evidence showing that it's helping people have a greater recognition of the most common mental health disorders. There's decreased social distance from people at work, increased confidence, and really a demonstrated increase in help actually provided, which I think speaks to it quite loudly. So since I have about 5 minutes left, I won't go into too much detail because I've kind of spoken to it. But starting on slide 52, I talk about how the Commission has implemented the standard.